The story of the South Dakota State University College of Nursing reflects a legacy of leadership, vision, and a dedicated mission to improve human health and quality of life for people in the state of South Dakota, the region, the nation, and the world. From its humble beginnings with 6 students and 1 faculty member in 1935 to today's college where more than 550 students are enrolled and being taught by over 50 faculty members, the College of Nursing has become the flagship nursing school in the region.
I think if we take the context of 1935 and then take the context of a land-grant university, outreach to meet needs of the state, certainly health has always been a priority of our state, and access to education is a priority. And for nurses, advanced education was hard to find. Nurses were educated in hospitals at the time. They earned a diploma degree, and it was a great degree for practicing nurses. But for people who wanted to move on into higher education and to teach nursing and to advance their education, they needed to earn a Bachelor of Science degree. And that's what got it all started in 1935.
There have been 14 leaders in the College of Nursing over the past 80 years, starting with Layla Given, who established the Department of Nursing under the Division of Pharmacy in 1935. Each individual brought her own leadership skills to envision the future, through strategic planning and a responsibility to meet the ever-changing needs of the healthcare industry.
I came to South Dakota State University to interview for the deanship and absolutely got turned on by the context. Sherwood Berg was the president, Harold Bailey was the vice president, and I thought, well, this could really be an interesting challenge. And then, of course, I was Dean of Nursing for almost 10 years, changed the scope of nursing, I think, in the state because of what we were doing.
Strong leadership built a multifaceted College of Nursing based on several key initiatives: faculty development, a strong curriculum, partnerships, and a continuous flow of qualified, committed students.
If we didn't have the stellar faculty that we have that are so engaged with what they do with the students wouldn't do as well. We have an excellent curriculum, we attract excellent students, but you've got to have a faculty who can get that information across to them.
A strength of the College of Nursing has been its ability to adjust to an ever-changing healthcare field through the addition of new programs and new opportunities. In the 1950s, leaders recognized that preparation of registered nurses should occur in a university setting.
So a standardized program starting in 1952 meant that we were recruiting students who were fresh out of high school in pursuit of a Bachelor of Science degree. Prior to that, we were attracting nurses who were already nurses who were in pursuit of a Bachelor of Science degree. So the curriculum has to change. The background of the student population is very different. They're coming right from high schools. 1952 was a great time for the College of Nursing. It was a chance to really examine a curriculum that built on the basic human and social and biological sciences and mathematics, that core, and then creating the curriculum to earn a Bachelor of Science degree and to be able to practice in acute care and public health settings, and of course be prepared for entry into practice.
As medical centers began to build their executive staff, the need for more and better prepared nursing leaders led to specialized graduate programs, starting with the Master's of Science degree in 1979.
That Master of Science degree meant that advanced practice roles as a clinical nurse specialist, or perhaps a specialization as a nurse educator, or a nurse administrator, we're available and we're going to make a contribution to not only nursing education, but to leadership in healthcare and also into advanced practice in quality care.
The message from Sherwood Berg and Harold Bailey and Chris Sword, who was the Dean of Graduate School, is we've got to get this thing pounded together. And immediately, I had a lot of experience writing grant proposals to the Division of Nursing. And I immediately got in touch with them. In fact, I went to Washington, D.C. and read some proposals that states like ours, New Mexico and some of the more rural states, had written to get master's programs going. And wrote the proposal that got us the startup funds.
Later, the PhD program was started in 2005 and the Doctor of Nursing practice in 2009.
One significant moment among many was when the PhD program was started in 2005, and then on the heels of that, starting the DNP program. So these were two areas of graduate education that were focused heavily on the generation of knowledge and the application of evidence that comes from the generation of new knowledge.
The most exciting thing that's happened has been the PhD program. And I never in a million years when I graduated with my PhD thought I would have the opportunity to advise PhD students. We had the right mix of courses, faculty expertise, and have built a successful program, and I'm going to say we've got 21, maybe 22 graduates now.
Those were very exciting times because there again, SDSU was the forerunner in nursing education, and we were the first to have a PhD program in the state, the first to have a DNP program in the state, and the first to have a joint partnership for the Clinical Nurse Leader program, which we now have solely on our own.
I think we do have at SDSU a pioneer approach to how we respond to what our society needs, and to me that's a unique thing about SDSU.
Being the first in graduate nursing education in the state made SDSU a leader in research and innovation.
Research is absolutely critical to every nurse's role. There isn't a single role in nursing where people do not rely on evidence and research and adapt it to meet patient care needs. And so that foundation of building on evidence and using evidence is critical to the nursing role. And I think because nursing students are so well prepared in how to read research, how to interpret research, and even how to design and participate in research, they're well positioned in these magnet hospitals like Avera and Sanford to be able to participate in research projects, to design research projects, to use evidence-based practice in multidisciplinary teams to improve care.
The role of research in the College of Nursing is essential and vital. And as we have had more doctorally prepared faculty, the emergence of our specializations and our strengths has really blossomed. For example, right now we have 2 National Institutes of Health funded studies working with American Indian communities and populations. We have multiple studies that are funded working with rural populations. And they all center around important topics like relevant health education, patient education, supporting families for good health outcomes, supporting people at the end of their lives for access to quality of care and support for their decisions about the kind of care that they want.
Outreach and partnerships will continue to serve as important objectives for the College of Nursing, particularly in identifying ways to encourage and support underserved populations in South Dakota.
A priority of the College of Nursing has always been diversity of the healthcare workforce in our state. And we know that we need to do better in educating American Indian students into nursing. Less than 2% of our nurses are American Indian, and yet we have about 9% of our population that's Native American. We've always focused on providing quality education that's accessible, that's culturally relevant for Native Americans, and we've pursued funding opportunities that support that goal and that dream. On the same vein, it's also our dream that health concerns of the communities be addressed by people who live in the community. And so educating our students for advanced practice roles and for building the science of nursing and doing research is important for all of our students, but especially for our Native American graduates.
SDSU led the charge by making nursing education accessible across the state of South Dakota. Rapid City began offering RN upward mobility classes in 1977, followed by baccalaureate and master's classes in 1989.
In 1989, what happened was Rapid City Regional Hospital decided it was time for them to close their diploma program. So they hung on a little bit longer, but they needed nurses in Rapid City. So their vice president for nursing at Rapid City Regional worked with Carol Peterson and others to bring the baccalaureate program from SDSU out there.
But that standard option being offered in Rapid City meant that students who graduated, who lived in that area and wanted to stay in the area, or perhaps students who were interested in pursuing higher education there and wanting a nursing degree, had an option to do so.
Sioux Falls was added as a site for the accelerated undergraduate option in 2002. The Sioux Falls Standard program was launched in 2011. Aberdeen opened its doors to the accelerated program in 2012.
Those students enrolled in the accelerated program are already educated at the Bachelor of Science or even advanced level beyond that. It's a huge undertaking for very ambitious people who are very bright. And when we started the program in 2002, I was on the teaching faculty, and I remember Dean Olson saying to us, we are starting an accelerated program, and it's going to be the same curriculum, and it's going to be 12 months, and we're going to start very soon. And I remember thinking, how are we going to do that? Where are these students going to come from? What will the clinical practice partners think of these accelerated students going through the program in 12 months? But we all got on the bandwagon with Dean Olson. We put the curriculum together. Some of our best and brightest faculty taught the original courses there, and that enrollment in our accelerated program in Sioux Falls and now in Aberdeen has been strong ever since.
In the first 80 years, the College of Nursing has evolved from a department in the Division of Pharmacy to a full college that is advancing the healthcare industry. The next 80 years will further establish South Dakota State University's role in the improvement of human health and quality of life for people in the state of South Dakota, the region, the nation, and the world.
I hope that 80 years from now, if we were to do this interview again, and what I would expect is that we will see an explosion in terms of the involvement of our faculty and our graduates in what we call team science, the analysis of big data, and that will come because of our partnerships with our major care providers in the state, as well as other interdisciplinary partnerships we are growing, but that will not be the exception, it will be the norm. And that because of the knowledge that will be generated through innovative projects and research, we will see better patient outcomes. And by better patient outcomes, what I'm referring to specifically is less rehospitalization, a decrease in in-hospital error, and hopefully, most of all, a focus on wellness and prevention.
I see a lot more happening in terms of a technology guiding nursing, much more in telehealth, much more with what we even see now with some of the patient at home and talking with probably the nurse on camera, not just the physician that you might see now.
I think you'll find nurses taking leadership roles in parishes, schools, industries, communities where we maybe haven't seen them before. We're going to have a lot more genetics and health promotion types of issues to keep people's lifestyles so that their health can be maintained into their 120s, 130s as the lifespan extends. But if you'd asked me this in 1969 when I started teaching, I would never have been able to predict where we are today.